A Deputy Prime Minister Dr. Horace Chang says the island's public hospitals should see an ease in the shortage of medical oxygen this week. His response comes as hospitals are now scrapping to get by as the shortage worsens. Anthony Lugg reports.
Hospitals island-wide have been grappling with a shortage of medical oxygen as a result of the increased demand from the spike in the number of COVID-19 hospitalizations. Director of the Western Regional Health Authority, Errol Green, says the Cornwall Regional Hospital has been severely impacted.
The situation in Savlamar, which is one of our bigger hospitals, I've been getting reports over the past few days, getting reports up to Sunday evening that they were almost out. They would have been out, all things being equal, by Sunday evening. The situation is worrying. We're appealing to IGL to see what can be done to improve the situation in the Western region because we are desperate now.
On the other side of the island, Chairman of the Southeast Regional Health Authority, Wentworth Charles, said the Kingston Public Hospital, Spanish Town, Princess Margaret and Linstead hospitals are also grappling with the shortage.
We are seeing a demand now of anywhere between 400% to 500% demand in the institutions. And we are for cases like Spanish Town, where we would have supply once per day. We now require 2-3 times supply per day. And certainly throughout the region, we are having this increased demand that has placed a heavy strain on the institution.
But on Monday morning, news came that the facilities could be seeing a relief in a matter of days. Deputy Prime Minister Dr. Horace Chang spoke with journalists after receiving his first dose of the COVID-19 vaccine in St. James.
We should see some relief there. It is a major problem. They have not had this demand on cylinders for a long time. But the company is functioning well. They are working smoothly, just the shorter cylinders. And it had to do with shipment disruption coming from the Far East because of COVID-19. But you can assure the nation they're getting relief this week.
Hospitals will now have to wait days, but every second without sufficient oxygen at these facilities could mean life or death. But how could the government have allowed the hospitals to be in such a crisis, especially when the Health Ministry disclosed months ago that the spike in COVID-19 cases could result in pressure being placed on the healthcare system? Dr. Chang argues that the shipment had been delayed.
They had a challenge and in terms of having cylinders. The factory is producing, and therefore they could provide the hospitals for the pipe supply of oxygen, but they have short the cylinders, which were delayed because of COVID. They have ordered from early last year when they heard the disease was spreading, and they ordered to get delayed, but they got us supply just yesterday. They cleared.
So as healthcare workers strive to give patients the best care, they, like many other Jamaicans, are hoping that the facilities will be equipped with the tools necessary to do so. Anthony Lugg, TVJ News.
And Dr. Chang disclosed that there are currently more than 300 active COVID-19 cases in the Jamaica Constabulary Force. Dr. Chang linked the high number of cases to community spread of the virus.
We have had significant impact. The police, the last time I checked, we had well over 200 positive and active cases. Been going around. They're part of the population. The police in particular work within the communities. And once you get the community spread, police officers are going to be affected. The Army has had a few, but not as extensive at this point. But bear in mind, the Army also is on the road supporting the police.